Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
And now, the Federal Drive with Terry Gerton, sponsored by GEHA.
Welcome to the Federal Drive on Federal News Network. It's Friday, June 12th. I'm your host, Terry Gerton, and I'm glad you're here. Coming up on this hour of the Federal Drive, ARPA H is testing a model to make research faster, more repeatable, and less dependent on where or with whom you work. Plus, a lot of health AI runs in places you might not see, and it's not always overseen in the way you'd expect. Those stories and much more ahead during this hour of the Federal Drive. We begin with this. New data from Democrats on the Senate Small Business and Entrepreneurship Committee shine fresh light on just how rough it's been for many small business contractors over the last 15 months. A new report from Senator Ed Markey, ranking member of the committee, found that since January of 2025, when President Trump took office, agencies have reduced spending by 19%, and thousands of small firms have left the federal market. For exclusive details on this new data and what it means for federal small business contractors, Federal News Network's executive editor, Jason Miller, joins me now. Jason, thanks for being here.
Thanks, Terry.
What is inside this report from the Senate Democrats about the state of small business contracting?
The numbers are fascinating because we've heard a lot of anecdotal evidence about the changes and the impact on small business contractors over the last 15 or so months. What Senator Ed Markey and his staff did was they just didn't say, okay, we're going to take those anecdotes and put a report out. They actually dug deep into publicly available data from sam.gov. They have something called a contract data report builder and pulled all kinds of information from that database and said, okay, what are we seeing around small businesses? What are agencies actually doing? Where is the money going? And based on Markey's report, it is a stark and concerning set of results here. According to Ed Markey and his team, small business contractors have seen a $47 billion reduction in terms of spending with small firms from agencies over the last 15 months. So again, since January 2025. On top of that, Terry, more than 6,500 federal small business contractors have left the federal market, according to Markey's estimates. And when you dig even deeper, it's not just small businesses at a high level. Every socioeconomic category, according to Markey's report, has felt the impact of the Trump administration's policies around federal small business contracting. I'll go through some quick numbers, and I know it's a lot here. Contract dollars for hub zone businesses, historically underutilized business zones, are down 31%. Now, we've talked a lot about 8A program. We know those dollars, both set aside and others, are down. Markey's folks found that the 8A program set aside dollars are down 29%. Contracts to women-owned small businesses, again, set-aside dollars, down 24%. And even veteran and service-disabled veteran-owned small firms, which, again, the Trump administration has really put a focus on to say, hey, we should do more for veterans and service-disabled veterans, they're seeing cuts when it comes to contracting by 11%. So across the board, it's not just small business in general, but we really dig deeper into those subcategories and see everyone is feeling really the impact of some of the Trump administration policies when it comes to small business contracting.
Jason, it's not just new contracts either, but really the committee found current small businesses are also facing a tough environment.
That is so true, because what they also looked at is how many of the contracts that were terminated for convenience. We know DOGE came in and started slashing and burning a lot of contracts. About 65,000 contracts were terminated for convenience over the last 15 months. And what Markey's team found was about 60% of those 65,000 contracts terminated for convenience were held by small businesses. And again, Terry, go deeper into those numbers, it becomes even more stark. Small disadvantaged businesses held about 10,000, almost 11,000 of those contracts that have been ended by the administration. Service disabled and veteran-owned small businesses saw about 6,400 contracts terminated for convenience. So again, it really is hitting those small business contractors in a bigger way than maybe we knew about or really could imagine. And it's not so much that these contracts should have been kept just because they're held by small businesses. But I think anytime an administration comes in and says, hey, we need to relook at what we're doing, we need to take a better perspective, I think there's a lot of different policy and factors that play into those decisions. And if they're canceling a bunch of contracts that are going to impact small businesses, they have to understand that that's part of this challenge. And I think what Markey's report is showing is that sometimes the words of supporting Main Street, supporting small businesses, supporting this sector is not necessarily being translated by the actions that the Trump administration has taken. I think that's one of the highlights they're trying to point out here.
And Jason, has the White House responded to this in any way, to your point about are they mixing their messages?
I've asked a couple emails both to OMB and the Small Business Administration. They have not responded yet. I've also reached out to Senator Joni Ernst, the chairwoman of the Small Business Committee, who's been a very big supporter of the administration's audits and reviews of the 8A program, expressing big concern about fraud, about waste, about not lack of competition. And she also has not, her team has not responded either.
Jason, you mentioned up at the top that the total value of these contracts was $47 billion. Is that work that just didn't get done, or did it migrate somewhere else? Does the report tell us anything about that?
The report doesn't touch upon that, but when you broaden this out and you say, okay, well, maybe contracting just dropped across the board. Maybe, the Trump administration came in and said, we got to be more efficient. We got to be more effective. We've got to reduce spending. There's a national debt issue. So when I looked at, okay, well, did spending drop across the board for contracting? Maybe that's can explain some of this. But recent data from the Government Accountability Office, they every year one of my favorite times of the year, put a snapshot of federal contracting out there. And this is from just this past June. And the data shows that actually contract spending in fiscal 2025 grew to $793 billion from about $755 billion in 2024. Now, GAO also found that small business contracting did drop in 2025 by about $3.7 billion to $172.6 billion. Now, I did ask the committee, well, what's the difference here? The committee found almost $47 billion in reductions to small business contracting, and GAO is saying about $3.7 billion. I'm still waiting to hear back from the committee, but my assumption here, Terry, is just looking at the data, is the committee looked at 15 months of data, so January 2025 through May 2026, while GAO just looked at fiscal year 2025, which is a much shorter time frame and also does not include this first 6, 7, 8 months of this fiscal 2026. But either way, small business contracting did drop, and whether it's $3.7 billion or $47 billion or some number in between, that obviously is showing that the Trump administration's policies are having an effect on small businesses.
Speaking of effect, then, what does Senator Markey hope this report generates?
I think there's a few things that that the committee's hoping for. Number one, I think they want to shine a light on what's happening. I think anything they can do to say, hey, pay attention to this, not just on Capitol Hill or within the government, but the broader community. They want people to rise up and kind of raise their hand and say, hey, this is a problem. In fact, they broke down the impact by state. And this was also really interesting because it's not just, a few states here and there. Out of the 55 states and U.S. territories that they looked at, so it include places like Guam and Puerto Rico and America Samoa, 48 of those were impacted by the reductions in a negative way. American Samoa, Delaware, Maine saw reductions in small business contracting by more than 40% over the last 15 months, while some of the more than a dozen states saw reductions of contracting that totaled more than $1 billion, with Virginia seeing the biggest drop by over $7.1 billion. Now, so I think that's one thing they're trying to do, is say, hey, this is not just affecting some Beltway bandits, some people in the D.C. metro area, but this is impacting almost every state and territory for the U.S. government, which impacts jobs and impacts people's life. The second thing I think what Markey is trying to do is kind of push Kelly Loeffler, the administrator of SBA, to testify. The Senate Democrats and the committee wrote a letter to Loeffler saying, hey, you're the only member of the cabinet who has not agreed to testify before Congress this year, and you have not appeared before the Senate Small Business Committee in over a year. So I think this is maybe part of the way to push on her to say, hey, explain your actions, explain what's going on. I think the American people have a right to understand what your goals are, where you're heading. And then finally, I think the other piece of this is Markey is a supporter of the Rule of Two bill. This is a bill that says any contract over the simplified acquisition threshold, any micro purchase threshold, that the agency can find at least two qualified small businesses who can provide the service or product at a reasonable price. the contract should be set aside for a small business. That bill got through the House in May. The Senate has not picked up the companion bill, though it got introduced to the Small Business Committee last August, but it has not moved. So I think this is also Markey's way of pushing a little bit to say, hey, this is an important bill and we should move forward with it.
That's Federal News Network's executive editor, Jason Miller. Jason, thanks for bringing this report to our attention.
My pleasure, Terry.
You can find his full story at federalnewsnetwork.com. Up next, ARPA H is testing a model to make research faster, more repeatable, and less dependent on where or with whom you work. This is the Federal Drive with Terry Gerton on Federal News Network.
Tune in Tuesdays at 10:30 a.m. and 2:30 p.m. for the Innovation in Government Show, sponsored by Carasoft. Hear from the industry leaders advancing the technology shaping how agencies modernize secure operations and deliver better services. Innovation in Government covers what is changing now, what is working from cybersecurity and cloud to data, AI, and emerging technologies. Listen to Innovation in Government, Tuesdays at 10:30 a.m. and 2:30 p.m. on Federal News Network. Search Innovation in Government.
Welcome back to the Federal Drive with Terry Gerton on Federal News Network. The limits of biomedical research often come down to access to tools, networks, and where the work happens. ARPA H is piloting a system meant to level that out while improving reliability. Here to tell us how this will all work is Dr. Paul Sheehan, Program Manager for EGOR at ARPA H. Dr. Sheehan, thank you so much for joining me.
Oh, thank you, Terry, for having me.
We always love talking to the folks at ARPA H. You guys are doing some amazing things over there. And today we're going to talk about EGOR, not Dr. Frankenstein's lab assistant, but the intelligent generator of research. First of all, what is the problem that ARPA H thinks EGOR can help solve?
Thanks for asking. We think that the primary goal of EGOR, the primary problem that can solve, is really just efficiency in research, right? And so there are challenges to scientists day by day when they're trying to move things forward, trying to get new therapies for patients, trying to move forward. And that, not only is biology complicated, but their day-to-day capabilities of getting it done can be challenging. And that comes from multiple directions. Some of that is just that there's so much going on, keeping on track of it, right? And there's progress being made already in that. But even beyond that, finding what is the next most important problem to solve in an area is challenging. We feel that AI can be an assistant to researchers on that. What's the next most interesting thing? And then there are other things, like sometimes I'm doing research and I'm, working hard in one area, and then I'm working with AI and says, hey, I need research all the way in this completely different area. I don't have that instrument. I don't have that cell in the freezer. I don't have that capability, and I don't have a friend down the hall who can do it. How can I go out and find that other person who can do that work, right? And so that's another aspect of this whole program, building out a marketplace, building out a way to communicate to other people how to get work done. So if you see, like, at large, what we're doing is trying to wrap lots of capabilities around researchers to help them go faster and deliver therapies to patients.
Is part of the problem that you're dealing with that we've already solved a lot of the easy problems in biomedical research, and now the problems are more complicated? They cross multiple systems, or there's multiple biological systems, or they cross multiple specialties?
Well, as being trained as a physicist, I'm not sure there are any easy problems in biology. They all seem to be complicated, but I do think that we're at a point where some of the experiments that could have been done to date, they've all been done, and we're left with kind of complicated problems where there are lots of different cells doing lots of different things, communicating in many different ways, and that information is inherently difficult for humans to think about, right? This, we call it high dimensional information. And so that's one of the reasons AI is so useful, because it natively easily works in this high dimensional space and can identify those problems.
Walk us through how a research question might actually move through this system once you have it up and running.
Oh, great question. Right. So we feel that this process can be applied to many different diseases, many different therapies that one might propose. But if one, we're trying to go after, say, a metabolic disease, something like that, right? First, you'd use, frontier models, the models that are out there that have ingested all the literature, say, to build out like that initial model of how this disease might progress. Then you would use a different tool to analyze that model and go, okay, here's the gap. Right, this is what we don't know. This is the most important experiment to be done. Researcher can then go, oh, I can do that, and they go off into the lab and get that done. But it could be that next most important experiment may need to be done by somebody else or a colleague, and then it will help you convey what that experiment is. And this, it doesn't sound so hard, but it's one of the main issues facing science. Like, what did I do, or how should this experiment exactly be run so you get the same results? And that's part of the program, is like conveying that information, right? So that some distant lab can perform that experiment correctly and give you back the information that you're expecting. It's a challenge, and we're excited to see what proposals people come up with to answer it.
I'm speaking with Dr. Paul Sheehan. He is the Igor Program Manager at ARPA H. Dr. Sheehan, you just said something in that description. You said the AI will ingest all of the existing research. Are you confident that AI will draw the right conclusions from all of that existing research? How are you going to put humans in the loop to say, no, that's not what would come next. Something else might come next?
Well, I mean, that is exactly what we're going to do. We're putting humans, leveraging all the creativity of humans, their insight, their ability to come up even new experiments that the AI might not know about, so that we can move forward, right? So the AI is going to point to meaningful areas, right, where it thinks the gaps are, and we want absolutely human insight to move things forward.
The program documents suggest that you could move research forward as fast as 10 times faster than it is today. What would that look like and feel like to the researchers in this space?
Well, I hope it'll feel exhilarating. All of these researchers want to solve a problem, right? I mean, you talk to them, they're passionate, they want to understand what's going on, they want to help patients. So being able to move even faster, I think, is going to be exhilarating for them. And again, we are designing this to bypass the roadblocks that they run into, right? Keeping up with the literature, identifying the most meaningful problems, working with others, and we're trying to break down all the barriers so that they can move fast.
This is not a project yet. It is a request for information and solicitation, I think. How do you envision teams participating in this over the course of a 5-year program?
So, right, we are in source selection right now. That means we are having a proposers day on June 9th for people to come in and team up on this very ambitious program. We're looking for the initial ideas about a month from now on June 25th, so that people can send in ideas. And then it's really pulling those teams together, identifying the best ones, and having them work together. Folks, not only from automation, but the biologists, the researchers themselves, AI specialists, all working together to solve this problem.
You're imagining teams that are going to cross a lot of boundaries that have been difficult to navigate. How do you hope to see early progress?
So this is what ARPA H does all the time, and this is how we make progress, as we pull these disparate teams together to move forward. So part of it is these proposers day, bringing them together, and a lot of computer scientists might come in. It's like, I love the problem, love automation, but I don't know anything about biology, or vice versa. And so we put these folks into the same room. They talk about their research, and they team up to come up with the best possible solutions for the problem.
Are there particular problems that you expect folks want to tackle first?
So we're open to a wide range of disease, hoping people, take on the most challenging problems. And then beyond that, I do think one of the most challenging aspects is, how do we communicate clearly from one person to another on exactly what needs to be done? Communication is always a challenge, especially so in science, when you're asking for something very specific.
So as this model matures, Igor, the lab assistant, bringing all of this research together and putting it back out there, what kind of researchers are you expecting to be paying attention so that they are these university researchers, hospital researchers? Is it international? Who's going to be part of the network then that uses the information that Igor pulls together?
So we expect to have, the teams using their own Igor to assemble around different diseases, right? So it's not one Igor for all research, but if someone, for instance, wanted to study some rare disease, I would like to stand up an Igor for this particular disease. It would ingest all the information about it and would direct research in that area, collaborating with the researcher. Right. And so everyone would focus on different areas. So it's not one, system for everything, but the Igors would be associated with different diseases, different efforts.
So how then do you imagine that it scales? Does it replicate or does it kind of all grow together over the longer term?
Well, we hope in the long term it all grows together. Many people are very eager to have a digital twin of humans. Can we just compute everything that's going on inside the human body all at once? And the way to get there is to build up from component to component. And we feel that's what Igor is doing, building up mechanistic models of subparts of humans. And then ultimately we will piece all these together into a model of the human as a whole.
I've been speaking with Dr. Paul Sheehan. He is the Igor Program Manager at ARPA H. Dr. Sheehan, thanks so much for sharing this program with us today.
Thanks so much for having me.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts. Still to come, the people who rely on Medicaid help design a plan to curb fraud without putting their own care at risk. But first, a lot of health AI runs in places you might not see, and it's not always overseen in the way you'd expect. You're listening to The Federal Drive with Terry Gerton on Federal News Network. Welcome back to The Federal Drive with Terry Gerton on Federal News Network. From administrative decisions to care management, health AI tools are influencing outcomes in ways patients may never see. But many of those systems fall outside the usual oversight framework, and that can leave gaps in accountability and increase the risk of errors or inconsistent standards. Here to discuss her recent diagnosis of this space is the Bipartisan Policy Center's Maya Sandalo. Maya, thank you so much for joining me today.
Thank you so much for having me. I'm very happy to be here.
I'm very happy to have you. The Bipartisan Policy Center's got an interesting new report out that we're going to talk about, Understanding the Regulation of Health AI Tools. When you think about what the average person thinks about when you say health AI tools, I'm thinking about a fitness tracker or a wearable. What are you really talking about here? What does this report cover?
Yeah, absolutely. So my organization, the Bipartisan Policy Center, has done a lot of work to clarify that exact question. AI is used throughout healthcare delivery in many different ways. I broadly categorize it into two buckets just to simplify things. And I call the first bucket administrative AI. That's AI that's used for kind of operational and administrative purposes. So as a patient, you might interact with it for scheduling or kind of navigating your benefits. One of the fastest growing administrative AI applications right now is used by healthcare providers to record patient conversations. Those are called AI or ambient scribes. And then health insurers are also using it in claims, something called prior authorization. So there's a whole slew of operational uses for AI. And then there's that clinical bucket. There's traditional medical devices. That's AI that plays the form of a tool that is used to diagnose or prevent or treat a disease. And then there's all these other kinds of tools, such as the rings that people are wearing these days, the Apple Watches. So there's a really wide range of tools. And even within medical devices, a lot of different applications. By far the most common so far is for medical imaging. So we can go into details on kind of all of those as helpful.
That is a great setup. And so what sticks in my mind then is why ask the question of regulation? What is the problem with regulating all of those different buckets of health-related AI?
Yeah, there's a lot of different regulatory questions depending on the type of AI tool, right? So the Food and Drug Administration, which is an agency within the Health and Human Services, HHS at the federal level, regulates medical devices to make sure that they're safe and effective before they reach market, right? So the same question applies to AI that's used in clinical functions. We want to make sure that they're safe and effective before they're used on patients. And then you can imagine there might be a need for policy or oversight, let's say, for AI that's used to make decisions about if your healthcare procedure is going to be covered by health insurance, right? So there's a lot of different policy questions depending on the type of AI application.
One of the findings from this report is that many of these tools, as you just described, aren't classified as medical devices. And so it's not clear who has regulatory responsibility, or there may be multiple agencies that have regulatory responsibility. What does the playing field look like here?
Yeah, it's a complicated playing field, that's for sure. The same AI may be regulated by different entities depending on where it is used, the data that it's trained on. We map out the most common federal agencies that might play a role. So the Center for Medicare and Medicaid Services might play a role in coverage and reimbursement decisions related to AI, right? So the extent to which a healthcare provider is reimbursed for, or, a patient is reimbursed for AI used in clinical care. The Office of Civil Rights within HHS oversees something called HIPAA, and that's big for patient privacy. So any AI used in kind of traditional healthcare delivery and patient data and privacy questions is going to be overseen by that office. But that doesn't necessarily apply to the rings and the watches that people are wearing that kind of don't fall within the traditional healthcare delivery system. It's complicated, but it might not always apply to them. The Federal Trade Commission can get involved if there's misleading marketing about what these tools are intended to be used for. The Office of the National Coordinator for Health IT, which is a mouthful, is another agency that, certified electronic health records. So a lot of patients are familiar and providers use these electronic health records. And when certain types of AI are embedded into those tools, then they have purview. So it's a very complex web, right, that a developer and a provider is kind of navigating depending on the type of AI tool. And that's just at the federal level. States are also really getting involved. And so the same tool might have strict regulation in one state and not in another.
Maya Sandalo is Associate Director for the Bipartisan Policy Center's Health Program. Maya, what you've just described, I think, goes beyond what most people are imagining. And it sounds like AI is moving faster in healthcare than the regulatory framework to manage it. Everybody's adopting AI in one way or another, and maybe we don't have all the rules written yet. What kind of gaps or risks is that creating?
It's a great and important question. I think one central trend to keep in mind, which relates to your question, is that right now, the most common forms of AI used in healthcare are for these administrative purposes. So things like doctors using it to transcribe notes and insurers using it to review healthcare claims to figure out what the patient and provider will be reimbursed for, and what will be covered. Right? But there's so much potential in these clinical applications of AI. There's so much potential for AI to help prevent disease early, diagnose more accurately, treat really complex diseases. And right now, the regulatory framework is so complicated, and the payment mechanism for that is not very clear. So there's kind of a chilling effect of sorts. So I think there's a big policy question to be had about how can we create regulatory frameworks and policy and payment policies to make sure that these safe and effective and high value solutions are really reaching the patients who need them most.
Who's going to take the lead in developing that policy framework?
Right now, I would say a lot of states are trying to think about this, right? And states are the laboratory for democracy. And so there might be some best practices and lessons learned. But at the same time, these technologies operate at a national level, right? The same developer might be trying to deploy tools throughout the country. And so a lot of people think that there's a need for a federal framework, right? And HHS is the federal agency that oversees healthcare delivery in a lot of ways. And so they're really actively thinking about that right now.
In the meantime, the opportunities for industry to profit tend to sit in those regulatory gaps, right? So how are the incentives for industry playing into the regulatory process?
Yeah, I think this is so important. And the goal is to create a regulatory framework that developers, right, and technology companies are incentivized to go through rather than go around, right? Right now, it can be so complicated to get through it, and there's not clear payment on the other side of getting through it, that there's a lot of incentive to say, what I am producing, what I developed is not a medical device. It should not be regulated by FDA. There's a lot of controversy, right? Where maybe a user of an AI tool, a chatbot, for example, might not realize that these aren't regulated and they're not intended to be used for diagnosis or treatment purposes. And so we need to create a framework where developers are designed to really go through it so that patients are interacting with safe and effective tools.
That safe and effective piece comes up because another function of the regulatory environment is to assign liability when things go bad.
Absolutely. That is a big question right now, liability, right? Really right now, a lot of the times providers are held liable for if something goes wrong when AI is used in their care. States are thinking about this actively. There's an important policy development to note in this space. The Office of the National Coordinator for Health IT, ONC, a few years ago put forward this model card or nutrition label policy, where essentially developers had to give some information that people were comparing to a nutrition label about how their AI functions, right? And it kind of made sure that healthcare providers were aware of that and shared more of the risk. Early January, the new administration proposed to roll that back. There are proponents and opponents of this proposed rule, but I will say that some providers are really concerned that it will leave them without the tools that they need to make decisions about how AI is used in their healthcare and potentially increase liability concerns.
While we're in this sort of regulatory limbo, what do individuals need to know, both to protect their own privacy and data, but also to get the use of the power of these AI tools that are out there?
That's a fantastic question. I think the most basic answer is don't assume that an AI solution that you're interacting with is regulated in a comprehensive way in the same way that the drugs that you might be taking, right, are. And that's not to say that there aren't really powerful ways to interact with these solutions, but just be aware that they're not healthcare providers, right? And honestly, I think it's also good to talk with your healthcare provider about the tools that you're using and come up with a plan together about how to really use these in a way that augments care.
And where do you see federal regulation headed next?
Definitely something to keep an eye on. I would say there's bipartisan agreement about the need for a federal framework because of this state patchwork. The devil is in the details, and that's where the bipartisan agreement is harder to reach, right? But I would expect that to continue to be a conversation in the years ahead, the need for a federal framework, and also to make sure that the agencies at the executive level have the authority and the resources that they would need to play a bigger role in that framework.
Been speaking with Maya Sandalo. She is the Associate Director for the Bipartisan Policy Center's Health Program. Maya, thanks so much for joining me and walking us through, even just at this high level, a really important topic.
Yeah, thank you so much for having me.
We'll post this interview and a link to the report at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts. Coming up next, the people who rely on Medicaid help design a plan to curb fraud without putting their own care at risk. This is the Federal Drive with Terry Gerton on Federal News Network. Welcome back to the Federal Drive with Terry Gerton on Federal News Network. A new report on Medicaid fraud starts from the ground up. built with input from the people who depend on those services every day. It lays out ways to tighten up oversight while preserving access to home and community-based care. Here to walk us through the problem and the solutions is Leslie Ford, Senior Fellow with the Able Americans Program at the National Center for Public Policy Research. Les, thanks so much for joining me today.
Hey, thanks so much for having me.
You've got a new report out looking at home and community-based care in Medicaid. And you start from a pretty clear premise, I think, that fraud in Medicaid has to be addressed, but not at the expense of the people the program is meant to serve. Walk us through who this program is meant to serve and what you're seeing in that balance right now.
Yes, so Medicaid at its foundation, it was set up in 1965 by Lyndon B. Johnson. At its foundation, it was meant to serve individuals with disabilities. That's one of the core premises of this program. So individuals with severe disabilities, think someone living with cerebral palsy, a child with Down syndrome. We want to keep them in our communities, and so that's a premise of Medicaid. But when Medicaid was first set up, the only real care we could provide for these institutions was kind of in an institutional type setting. So think a nursing home or a hospital away from their communities, away from their families. It was a really sterile environment. In the 1980s, Ronald Reagan came in and he said, this was really inhumane. He met a little girl named Katie Beckett. And she could have lived at home. We had the technology to live at home, but the laws didn't allow it. And he ended that. And that's when home and community-based service came into being. So this is a lifeline for people who have severe disabilities. And most states, every single state has a waiver to allow them to spend Medicaid funds, federal Medicaid funds for this incredibly important program. But you've probably heard a lot that there's a significant amount of fraud in the program when we don't have really good oversight. So we're trying to balance these two things. It's absolutely essential for people with severe disabilities in this country. We have to make sure we're watching these funds appropriately.
There's a descriptive sentence in here that really caught my eye, and it says, there is typically great inefficiency in state HCBS program administration, which has layers of vendors or consultants on contracts with states to manage eligibility, financial reimbursements, and care. Yeah. When a system is structured like that, and it's focused on delivering care to the most vulnerable, there are going to be opportunities for folks, bad actors, to take advantage of that system. When you talk about waste, fraud, and abuse in this space, what does that actually look like in practice?
Yeah, when we talk to administrators in this program, and we talk to administrators across the nation, red states, blue states, and one administrator described it as a lasagna of providers. It's not just a government official at the top, a provider in between, and an individual with a disability at the receiving end. You're talking 10 to 20 providers in between that individual, that family with a disability, and the government official at the top. You have a provider who's going out and monitoring the other providers. You have a provider who's doing eligibility checks, and you have 5 to 10 in between. So when you have that many providers in between the government who's setting the budget or trying to set the budget and a family who's just trying to get by at the other end, that's where you see the radical inefficiencies start to happen. And so the second part of your question, fraud, waste, and abuse, we kind of group these things together, and they actually mean three really different things. And so when we're trying to tackle, radical inefficiencies, we're talking billions and billions of dollars of money that's not really making it to our end goal. We're going to have different solutions to make sure we're actually making sure our taxpayer dollars are making it to the individual who really needs it. So fraud, this means you said you were billing to get services to someone who has an individual disability. You never showed up. You billed, you never delivered the services at all. Straight fraud. You broke the law. We're going to come after you. You're going to either pay a lot of money or go to jail. That's what the fraud is. Waste, it's technically legal. This is government officials not overseeing the program well. Something that might be waste here is I'm going to bring up New York as an example here. So New York, over the past 8 years, their program more than tripled in size. And it's not serving that many more people. But There's something in HCBS called an activity of daily living. We call it an ADL. This is one of the ways we define, do you really need help in your home? How severe is your disability? And if I have cerebral palsy, for instance, I need 24/7 care. I have a lot of activities of daily living. I need help getting out of bed in the morning. I need help showering. If someone doesn't come, I might die that day. I can't get water. Now, that's 20 activities of daily living to get me through my day. If I have one ADL, that might be I need help dressing. Maybe. That's not a severe disability. So New York's HCBS program broadened their eligibility quite a lot to just one ADL. That increased their program quite substantially. In 2020, they looked at it and they realized, oh, wow, one ADL isn't actually a severe enough disability to really put someone on our program, and they raised it to 3 ADLs. That's an example of government oversight where it might be legal, but it might also lead to wasting dollars. Okay, so we have fraud, we have waste. Let's look at abuse. I think abuse might be in the category that we're hearing about a lot right now in autism services. Obviously, we are much better at diagnosing children and adults with autism right now. And we have many more ways to serve those children and adults with autism. But there are many more unscrupulous actors coming into that environment right now. We've heard the Wall Street Journal reporting on cases in Indiana and across the nation, cases where providers are billing $30,000 a day for autism services, $900,000 a year for a child with autism services, while they're paying. Now, who's providing those services? Someone with a high school education getting paid $20 an hour. So that's clearly abuse. It's technically legal, clearly abuse. So we have fraud, you're not doing anything. Waste, that's really bad oversight. Abuse, you're technically within the law, you're just stretching the law like wild. Fraud, waste, and abuse.
Leslie Ford is a senior fellow in the Able Americans program at the National Center for Public Policy Research. Leslie, that is a really helpful framing to get folks really kind of keyed in on what you're looking at here. The report offers 6 recommendations for tackling that. Tackling waste, fraud, and abuse in Medicaid is high on the Trump administration's list. What are your recommendations here?
Yes. I mean, we're going to step back. We're going to look at radical transparency. So if you were to talk to any family who's on this program, any parent who has a child who's participating in the program, they're going to say the first thing is, I have no idea what's going on. If I'm on a wait list, and the majority of people who are on wait lists is someone with an intellectual disability, 75% of these people, I don't know where I'm on a wait list. I don't know when I'm going to get off the wait list. I could be waiting for 8 years to get the services I need to survive on a day-to-day basis. Let's get radical transparency into wait lists. Let's get radical transparency into who the providers are and how much they're charging. So number 1 is transparency. 2, we have CMS's Center for Medicaid and Medicaid Services. They're the federal oversight of the states who oversee this program. They oversee improper payments, but they don't really have a continuous mechanism for overseeing fraud, and they could do that. So we should have a continuous mechanism for overseeing fraud. 3, we really truly need to implement state oversight, and the states need to really take that by the reins. So one of those things could be third-party auditors. Only 3 states have third-party auditors who are taking a look at their billing codes. It's not just enough to say, hey, I'm going to be looking at that. You really do have to bring an outside consultant in to have a second look at that. 4th is, we've talked about that lasagna providers in between those government officials and those families who are caring, providing 20 to 30 hours of care for those family members with disabilities. We should be empowering those families and those individuals with disabilities. They should be in charge of those dollars. They should be able to choose the providers who best serve them. And honestly, they don't have any of that right now. We have the mechanisms to do that. We could empower them. So 4th is empowering those recipients. 5th is something we would think is obvious, but we should be measuring outcomes for the success of these programs. Like states, how many people are you moving off your wait list? How healthy are you keeping these people in your programs? Are you even setting up a measure of success? We should be measuring outcomes. And 6, we have to set up honest to goodness guardrails around public integrity for the providers who are in this program. The fraud, waste, and abuse is really laid at the feet of the providers who are taking advantage of the system. So those guardrails are incredibly important. It can be as simple as saying, if you are a provider in any state across the nation, you have to disclose every single entity that's billing Medicaid. We don't know if you're in one state billing Medicaid and in another state in a different entity with a different LLC billing Medicaid for something else. Bad actors will set up many different entities in order to avoid red flags in the system. Those are just some basic good governance reforms that Congress, the administration, or states could take to make sure that we tamp down on fraud, waste, and abuse.
So there's always a challenge in these sorts of public benefits programs when you tighten up oversight that you make access to the program more challenging. If CMS were to take on your recommendations, how would you want them to manage that balance, making sure that folks who need the services can get them, but that there's appropriate oversight to make sure that the system is being administered well?
Yeah. As we developed these 6 recommendations, that was at the heart of our consideration, was the families who are at the heart of it, the individual with a disability. So putting transparency first was talking to every family that we have in our network. What do you need? And the first thing they told us was, I would just like to know who the providers are. I would like a list. I would just like to know where my kid is on the wait list. I would just like to know, hey, if we relocate to a different state, what the steps are in that state and how long it would take us to get off the wait list in that state. These recommendations are actually crowdsourced from the families in the program. So when we're making these recommendations, they are at the heart putting the individual with a disability, putting their caregivers at the heart of the program.
I've been speaking with Leslie Ford. She's a senior fellow in the Able Americans program at the National Center for Public Policy Research. Thanks so much for joining me and sharing your recommendations on a program that's really, really important.
Oh, thank you so much.
We'll post this interview and a link to the report at federalnewsnetwork.com/Federal Drive. Listen to the Federal Drive on your schedule. Subscribe wherever you get your podcasts. The emergence of artificial intelligence-driven cyber threats is forcing a shift in how agencies manage software vulnerabilities. In a new directive released this week, the Cybersecurity and Infrastructure Security Agency laid out how agencies should prioritize the highest risk vulnerabilities on their networks. Federal News Network's Justin Doubleday joins me now with more insight. Justin, great to have you.
Hey, Terry.
All right. There's a lot of cyber news rolling out from this executive order. What are the details of this new directive?
There sure is. This is one of the more immediate actions that's coming from that executive order. And what this binding operational directive from CISA does is kind of set a new framework for how agencies should prioritize those really high-risk vulnerabilities on their networks that might pose a really urgent threat to their operations or their data or anything like that. And so it's creating a new framework that each agency can follow depending on what they have in their systems. And this is driven by these advancements in new AI models that could allow hackers to more quickly identify software vulnerabilities and exploit existing vulnerabilities before they can be patched or mitigated. It's really speeding up the mitigation timelines in some cases. And so what CISA wanted to do here was ensure agencies were focused on really quickly patching the vulnerabilities that do pose a risk to them, while being allowed to push back perhaps some of the less urgent vulnerabilities that, while they're still a challenge that they need to address, don't necessarily need to be mitigated in just a few days. Chris Butera, Acting Assistant Director for Cybersecurity at CISA, said the approach should allow agencies to, quote, patch smarter, not harder.
We really believe we should be able to free up some time to patch the most urgent vulnerabilities faster, while allowing for kind of more regular patch cycles for some of the lower risk vulnerabilities. And so we are hopeful that this binding operational directive will not require additional work for the agencies, but rather allow them to better prioritize the patching.
So, Justin, how then will agencies determine which vulnerabilities pose the greatest risk?
So CISA's directive lays out kind of 4 primary risk factors they have to consider. The first is whether the vulnerable software or technology asset is connected to the internet, because then, of course, that would allow an adversary to really quickly find it and potentially exploit it if it's vulnerable. Second one is whether it's identified in CISA's known exploited vulnerabilities catalog. Whenever CISA adds a vulnerability to that catalog, as the name implies, it means that it's actually being used by hackers in the wild, and so it's a big priority. Then the third is whether this vulnerability in question is capable of being exploited by automated means. And that's where this AI factor really comes into play, because if adversaries can use automation, they can much more quickly speed up the exploitation of that vulnerability. Finally, the fourth risk factor here is whether it would give the hacker partial or total control of the system in question. And so those 4 criteria are what agencies now have to take into account. If vulnerabilities, if the answer is yes to 3 of those criteria, then the patching deadline in all cases will be 3 days. And so that is actually much faster than historical federal patching deadlines, which generally have averaged between 2 and 3 weeks.
Is this going to be hard for agencies to do, or are they ready? Do they have the tools to make these determinations and make the fixes?
Well, it depends. On a case-by-case basis, agencies, some are much more well-prepared to deal with this than others. CISA said that they analyzed vulnerabilities at one unidentified civilian agency and found that 1% of the vulnerabilities there would require patching within 3 days, would meet that criteria, while more than 60% of the vulnerabilities could be deferred to the next system update, which could be weeks or even months, because those vulnerabilities just were not in line with some of those really urgent criteria that CISA has now set. Agencies also have some time to implement these new processes, about 180 days, and we can talk about that more later. And then CISA also pointed to the fact that they could have set a 24-hour deadline as kind of the default here for some of those most urgent vulnerabilities, but they think 3 days strikes that balance between pushing agencies to quickly patch the most urgent vulnerabilities while giving them some time to figure this out. Now, all that said, I've spoken with Todd Beardsley, CISA's former KEV section chief in the past. He oversaw this process. I've spoken to him about this previously, where he said, look, 3 days is going to be tough for a lot of agencies to do. They're used to a couple weeks in many cases. And in a LinkedIn post, he kind of still pointed out that even while this might be needed because of autonomous AI agents and autonomous cybersecurity attacks, these aggressive patching deadlines are going to be difficult for many federal agencies in the near term.
Well, speaking of deadlines, this is a binding operational directive, and you mentioned agencies have 180 days to do some things, but what are the key deadlines in the document?
Yeah, there's 2 ones immediately. So right now, agencies now have to start updating their vulnerability management policies in accordance with the new directive, and CISA may ask them for those over the next 60 days or so to make sure that they're actually carrying out the intent of this directive. And then, within 180 days, CISA wants all agencies to kind of analyze their vulnerabilities and remediate them in line with this directive if needed. And that's going to be the big heavy lift, I think, over these next 6 months or so, is agencies have to now look at their own systems and what they have on their networks and figure out, hey, is this a 3-day patch versus a 14-day patch versus something that can wait? It's no longer CISA telling every agency, you have 3 days, you have 14 days. It is agencies now having to take these steps to look at themselves a lot more closely in terms of what's an actual vulnerability or not. And while that's probably needed, that's going to be a big heavy lift for those CIO and CISO shops.
And how does this shift toward prioritizing high-risk cyber threats fit into CISA's broader strategy, Justin?
Yeah, it's interesting. I heard acting CISA director Nick Anderson speak earlier this week, and he kind of previewed this AI bod that was coming out and put it into the context of how he's really trying to bring a, quote, ruthless prioritization approach to everything at CISA. And that is because cyber vulnerabilities were already ramping up year over year, month over month before Anthropic's Mythos and other new AI models really kind of accelerated that even further and faster. And so now CISA is in the position of looking across both the federal government and critical infrastructure and having to say, okay, we can't patch everything everywhere all at once. We need to figure out what exactly is most critical. What exactly do we need to keep running? What do we need to plan on potentially losing as far as a service, whether that's power or whatever, and then have a backup plan so we can continue to operate through potentially an outage driven by a cyber attack or some sort of cyber activity. That's kind of the future that Anderson is laying out for CISA. It's something that they had already done to a degree, prioritization. It's not like they didn't prioritize things before, but he's talking about really bringing that down to more of a granular, intentional level than ever before because of the threat landscape.
That's Federal News Network's Justin Doubleday. Justin, thanks for this update.
Thanks, Terry.
You can find his story at federalnewsnetwork.com. The Federal Drive with Terry Gerton is produced by Eric White and Michelle Sandiford. Our web editor is Stephanie Wright. For the latest updates, stay with federalnewsnetwork.com or follow us on Facebook, YouTube, and LinkedIn. I'm Terry Gerton. Thanks for listening.